Let's now look at absorption of drugs from the GIT. Okay. So we have got this small map over here where we list out the factors which influence drug absorption from the GIT. Okay. GIT meaning gastrointestinal tract. So what are the factors? So there are factors related to the dosage form, and the factors which are related to dosage form are nature of the preparation, solubility, prodrug, and concentration. Okay. So let's learn about them one by one. Let's discuss them in sequence. Okay. So the first one, as we mentioned, is the factor related to dosage form, the nature of the preparation. Okay. So as a general rule, the order of absorption according to the dosage form. Okay, so when we say nature of preparation, what we mean is the dosage form. Okay. So what are dosage forms? Dosage forms are basically what? Yes, we talked about this. It's basically the drug plus excipients, which are formulated to serve as an acceptable means of administration to the patient. Okay, so as there are different types of dosage forms. We have tablets, we have solutions. Okay, so as a general rule, for oral absorption, the oral dosage forms, they follow this order. Okay, order of absorption would be solution would be faster absorbed than emulsions, and emulsions in turn would be faster absorbed than suspensions, and suspensions in turn would be faster absorbed than capsules, which in turn would be faster absorbed than drugs from tablets. Okay. And tablets, we mean uncoated tablets. Okay. So bear in mind when we say tablets, here we mean uncoated. Okay. So uncoated tablets are faster absorbed than coated tablets. Which in turn are release the drug faster than enteric coated tablets, and enteric coated tablets release the drug faster than sustained release. Sustained release tablets. Okay. So depending on the dosage form, the rate of absorption is going to decrease in this order. Okay. So the fastest one would be solution. Okay. So when we talked about tablets, we said tablets undergo the process of disintegration. Okay, and then that would be followed by deaggregation and dissolution. dissolution, and after that it gets absorbed. So solutions, they don't have this step. Okay? So this step is not there in solutions. Therefore, they are absorbed faster than tablets. Okay? They lack the disintegration and the dissolution step because they are already dissolved. Okay? So that's the reason why they they release the drug faster. And when we say coated tablets, so tablets are coated with maybe shellac, okay, which is obtained from the lac insect. And if you coat it with shellac, then it releases the drug slower. Okay? So what about enteric coated? Okay, so let's talk a bit about enteric coated tablets. So enteric coated, from the name itself, it's coated, and enteric meaning the intestine. Okay? So the reason is they are coated, so these tablets are coated with polymers, and what would be the examples of polymers? The most important would be cap. Okay? Now what is cap? Cellulose, acetate, phthalate. Okay. So this is a polymer. There are other examples of polymers like methacrylic acid polymers, like methylacrylate, methacrylic acid. Okay, methacrylic acid copolymers, and the other familiar example would be hydroxypropylmethyl, cellulose, phthalate. Okay. So there are other examples, but these happen to be the most common polymers which are used to coat tablets to make them enteric coated. Okay, so now we are going to discuss the whole concept of enteric coating. Okay, so why do we do this coating? Okay, so let's say why enteric coating? Okay, why are tablets enteric coated? Okay, so there are two reasons. The first reason is that sometimes the drugs which are present in the tablet, they may be degraded in the acidic environment of the stomach. Okay? So in the stomach, the pH is approximately equal to 3. Okay? So at this pH, the drug may get degraded. Okay? So let's give some examples. Examples, there is a drug which increases the gastric motility. It's called bisphenol. Okay? It enhances the gastric motility. It's given in constipation. So this drug gets degraded at this pH. Okay? So it is coated with, it's given a coating, an enteric coating. Okay? The other example is sulfasalazine. So this drug too we had discussed. This is to heal the gastric ulcers, if you will. Okay. So this drug is meant to get, metabolized by the gastric bacteria. Okay. We have discussed this example previously. Okay, so let's not repeat it. Okay, so that's an example of, these are examples of drugs which get degraded in the environment of the stomach. So the other reason is that, so the other reason could be that maybe these drugs the drugs may adversely affect the stomach. Okay, so the lining of the stomach may be, the lining of the stomach may be compromised by the drug. In such cases also we give an enteric coating is given. What could be an example of these drugs? It could be aspirin. Okay. If aspirin is not enteric coated, it may cause ulcers. Okay. It may cause gastric ulcers. The other example that could come to mind is potassium chloride. Okay. So this also irritates the stomach mucosa. So these are the main reasons why tablets are enteric coated. Okay, because the constituent drugs may degrade in the acidic environment of the stomach, or the constituent drugs of such enteric coated tablets may adversely affect the stomach. Okay, and we've got these examples. So this is the reason why these drugs are enteric coated. Okay, so they have got no problem. So the coating is not compromised in the acidic environment at this pH, but the coating breaks down in the alkaline environment of the intestine. Okay, in the alkaline environment in the intestine. So the pH of the intestine. Okay, so that is approximately about 7 plus. Okay, so in that alkaline environment, this coating breaks down and releases the drug. Okay, it breaks down and releases the drug, and then the drug gets absorbed in the small intestine. Okay, so now we know why it is enteric coated. Okay, so these drugs, if a patient takes this drug, it would take about about 6 to 8 hours, okay, before it begins to act. Okay, so in about 3 to 4 hours, it will reach the intestine, and the drug would be released in about 6 to 8 hours. Okay, so patients should be, because of this reason, patients should be counseled that the drug might take about 8 hours for it to act. And then the other thing is that in care homes especially, the elderly patients, they have got this habit of breaking down tablets and crushing them and spreading them on meals, and then they consume it that way. Okay? Okay? So such patients should be counseled that they are not supposed to do that with either coated tablets or enteric coated or sustained release tablets. Okay? But they may do so if the drug would not interfere with the food. Okay? So they can do this with uncoated tablets, which may not interfere with the food, which may not interact with the food. Okay, but the point being, coated tablets, enteric coated tablets, and sustained release tablets, or other delayed action drugs, they are not supposed to be crushed or subjected to mechanical deformation. Okay, it may defeat the entire purpose of the dosage form. So that's just an aside that we need to remember here. Okay, but the point being that different dosage forms would have different absorption rates. Okay, so solutions would be far most absorbed, and emulsions. Emulsions is basically a biphasic system where you got an oil in water or water in oil emulsion. So basically, depending on whether the drug is water soluble or lipid soluble, more lipid soluble or water soluble, these drugs are formulated as emulsions. Okay, so usually oil in water emulsions are the ones which are administered to patients. So that would contain highly lipophilic drugs. They would be formulated as emulsions. And as previously mentioned, they release the drug slowly into the GIT. So absorption would be rather slow. Okay. Okay. So that's the nature of preparation. Okay, so the dosage form influences the rate of absorption from the gastrointestinal tract. Okay. So that's the first point about how the nature of the preparation, or it's a factor related to the dosage form. So the second factor is solubility. Okay. Now, for a drug to be absorbed, it has to be, it should be lipophilic as well as hydrophilic. Okay. So ideally, a drug should have both these properties. It should be lipophilic as well as hydrophilic, meaning water-loving or lipid-loving. Okay. It should be both lipophilic and hydrophilic for optimal absorption. Okay. So if it is not lipophilic or hydrophilic, then it won't be absorbed. What could be an example? An example could be barium sulfate. Okay. So what is barium sulfate used for? It is used, it's given, it's ingested as a liquid, and commonly it's called barium meal. And what's the use of this barium meal? So the patient consumes the barium meal on an empty stomach, and then X-rays are taken every 30 minutes. Okay, till the barium meal, till it reaches the cecum. Okay. Okay, so that what's the cecum? That's the that's a junction of the intestine. Okay, so till it reaches the cecum, X-rays are taken every 30 minutes, and what does it allow? This is a contrast medium for X-rays, meaning it makes the X-ray more detailed. Okay, it makes the intestine more visible. And what's the advantage of that? It is useful in evaluating mechanical obstruction, dilation, or maybe intestinal diverticulum. Okay, what is intestinal diverticulum? Okay, so suppose this is the cross section of a normal intestine, and if there is a diverticula, this is what we see. Okay, so there will be kind of pouches in the intestine. Okay, this is ethanol. Okay, so it's useful. So barium meal is useful in evaluating mechanical obstruction, dilation, or intestinal diverticula. Okay, so what are these things? These are basically structural abnormalities that may interfere with small bowel motility. Okay. So if a patient is complaining of lack of bowel movement or a pain in the gastrointestinal tract and maybe bloating, then they would be asked to fast, and they would be administered barium meal and X-ray. They would be subjected to X-ray diagnosis in this manner that we mentioned, and it becomes useful in evaluating whether there is any structural abnormality. Okay, so it's basically a diagnostic procedure. Okay, so the point is barium sulfate here is neither lipophilic or hydrophilic. Okay, as a result, it won't be absorbed. It will continue to remain in the gastrointestinal tract, and it forms a contrast, which makes the diagnosis very easy. Okay, so it's a contrast medium. Okay, so barium sulfate is an example of a drug that is neither lipophilic or hydrophilic, and because of that reason it is used as a contrast medium. But the point being, for a drug to be absorbed from the GIT, it requires lipophilicity as well as a degree of hydrophilicity. Okay, only then would it be absorbed. Okay, okay. Which brings us to this third point on prodrugs. Now, certain drugs, if they are highly hydrophilic, okay, and this hydrophilicity may be due to non-ionizable hydrophilic groups or ionizable hydrophilic groups in the structure. Okay, so highly hydrophilic drugs won't be absorbed. Okay, it requires a degree of lipophilicity. So what is done is these non-ionizable or ionizable hydrophilic groups, they are esterified. Okay, esterified to form prodrugs. Okay, so when we esterify these kind of groups, they become lipophilic. By esterification, we increase the lipophilicity. Okay, so if we increase so the problem was it was highly hydrophilic. Now by esterification, we increase the lipophilicity. And then when we do this structural modification, we call it a prodrug. Now this prodrug goes into the liver or any other, it undergoes metabolic processes after absorption, and then it gets converted back into the drug. Okay, so these ways, by using this chemical modification, by making it into prodrugs, we can increase the absorption from the GIT. Okay, so there are lots of examples of these drugs. Let's list a few of them. So prodrugs, the examples would be, okay, enalapril. Okay, so this is a ACE inhibitors used for hypertension. Then there is this drug which is given for Parkinson's disease, levodopa. And then there are antiviral drugs like valgacyclovir. Okay, and most of the antiviral drugs are prodrugs of celtamivir. Okay. And there is a drug given for glaucoma, the prostaglandin, latanoprost. Okay, so these are all prodrugs. So prodrugs, they have got increased rate of absorption from the GIT. So prodrugs are rapidly absorbed from the GIT. Okay, so the last point in this the last point in this factor related to dosage form is concentration. Okay, so increased concentration results in increased concentration gradient, and that results in increased absorption. Okay, so increased concentration of the drug increases absorption. Okay, because there are certain laws called the Fick's law of diffusion. Okay, wherein the concentration gradient plays a role. Okay, so the point is, if there is increased concentration of the drug in the GIT, then it can result in increased absorption from the GIT. Okay, so if we look at this map here, we have talked about, we were talking right now about the factors related to dosage form, and we have covered the nature of the preparation, solubility, prodrug, and concentration. Okay, so these were the factors related to dosage form which influence absorption of drugs from the GIT. Okay, so next we are going to look at the formulation factors which influence absorption. Okay, let's remind ourselves where we are in the map. So we were talking about the absorption of drugs from the GIT, the factors which influence drug absorption from the GIT. We covered the factors related to dosage form. Now we're going to look at the formulation factors which influence absorption of drug from the GIT. Okay. Okay. So the effect of the study of the effect of formulation factors on drug absorption, the field of study is called biopharmaceutics. Okay. So we're going to learn a little bit about biopharmaceutic factors which influence the absorption of drug from the GIT. So the first factor is particle size. Okay. So the rule of thumb is smaller the particle size, greater is the absorption. So this is kind of intuitive because say this is a person and the person is consuming food. Okay. So what's happening in the mouth? The food is going in, it is getting masticated, meaning it's broken down to smaller and ever so smaller particles, and it's the smaller particles that eventually dissolve, and the nutrients get absorbed. So the idea being, before the dissolution step, you need the particles to be broken down. So if you have got particles which are smaller in size, then the absorption would be greater. Okay. So this idea is utilized for the formulation of drugs like griseofulvin. So this is an antifungal agent. Okay. So you have regular griseofulvin, but if you reduce the size, meaning you reach this size to the micron range, micron or nano range, then there will be greater absorption. So is micro particle sized griseofulvin available in the market? Yes. So the formulations that are available in the market are micronized griseofulvin, and there is ultra micro size griseofulvin tablets are available. Okay, so now we know why. Okay, what's the advantage of a micronized griseofulvin over regular griseofulvin? This would be absorbed faster. Why? Because it undergoes dissolution faster compared to regular griseofulvin. Are there any other drugs which are micronized? Certainly there are. Okay. The other example would be spironolactone. Okay. So this is an aldosterone antagonist. Okay. So aldosterone retains water. So if you give an aldosterone antagonist, that could be a diuretic drug. Okay, so spironolactone is kind of a diuretic drug, and that's again micronized. Okay. Any other drug that comes to mind? Yes, there is another one, progesterone. So the female hormone, this is also micronized. Okay. So now we know why we are micronizing, and we also understood that particle size influences absorption of drug from the GIT. Okay. So the second factor here is rate of disintegration and dissolution. So we said if we got a tablet, it undergoes disintegration, deaggregation, and then it undergoes dissolution. Okay, then it is absorbed. So if disintegration becomes faster, dissolution would become faster, absorption would become faster. So in a regular tablet, there are lots of different types of disintegrants, but recently there have been the development of super disintegrants. Okay. Okay, and what could be the example? There is crosscarmellose sodium, and there is sodium starch glycollate, and the other familiar one is crospovidone. Okay. So these super disintegrants, these are basically excipients. Okay, what is an excipient? It does not have pharmacological activity. Okay, excipient means no pharmacological activity. Okay, but they are used to make the formulation. So these super disintegrants, they bring about faster disintegration than the conventional tablets. Okay, so if we use super disintegrants, we can convert a normal tablet to a fast acting tablet. Okay, so there are different formulations of paracetamol fast acting tablet. Okay. So what does it contain? Fast acting tablets would basically contain super disintegrants. Okay. And what's the rationale of using that? It makes the tablet to disintegrate faster, and if it disintegrates faster, there will be faster dissolution, and if there is faster dissolution, there will be faster absorption. Okay, so rate of disintegration and dissolution influences the rate of absorption from the GIT. Okay. The third one is excipients or diluents used. So one of the excipient we have talked about is super disintegrants. Okay. So excipients, they are basically used to increase the stability or increase the bulk of the formulation. Okay. They, by definition, excipients have got no pharmacological actions. Okay. But this may influence rate of absorption. Okay. So that is why different companies would be using different excipients, and there might be a slight variation in the rate of absorption. Okay. But it might not be significant clinically, and therefore they are included in the Orange Book, and they can be substituted. Okay. So yeah. So generic drugs may not have the same excipients which are used in patent drugs. Okay. But the clinical response might not differ that very much. Okay. So that is why they are included in the Orange Book. So they can be substituted in place of trade named drugs. Okay. So the point being, excipients may influence the rate of absorption. Okay. So some physicians would swear by a trade named drug because they might have observed better rate of absorption. But it might not be clinically different from generic drugs. Okay. Provided the generic drugs are listed in the Orange Book. Okay. So we have covered, in the map we have covered the formulation factors which influence drug absorption from the GIT. Okay. Formulation factor influencing drug absorption from the GIT. So what are they? They are particle size, the rate of disintegration and dissolution, and the excipients or diluents used. Okay. So diluents are used for liquid preparations, and excipients can be used for both liquid and solid preparations. So yeah, diluents can also be used for solid preparations, like lactose. Lactose could be used as a diluent in tablets, okay, and excipients. So in all types of formulations, we've got excipients or diluents. Okay, they may have a bearing upon the rate of absorption, but whether they are clinically significant, one needs to look into the literature or the Orange Book to make an informed decision. Okay, but they may influence the rate of absorption. Okay, all right.